So, you, sir, are a 67-year-old male who's been diagnosed with new onset CHF, which is known as chronic heart failure. Now, to help your body adjust, you've been giving two new prescriptions, one for digoxin, one for lasix. Before we get to those prescriptions, I'd like to talk to you about what CHF, or chronic heart failure, is. Basically, to make a long story short, your heart is no longer working as well as it should. And this means that blood is kind of backing up within your system. Your heart's just not pushing it through your body as well as it should. So, in order to, and this can be caused by numerous issues, including a past MI, chronic hypertension, diabetes. There are many things that can cause the heart to not work as well as it should. However, to promote the heart working as it should, you've been given a prescription for 250 micrograms per dose, or per day, of digoxin. Digoxin is a drug that allows your heart to basically work better. However, it has a limited range where it will work the way it's supposed to. Too high, and you start developing what's called digoxin toxicity. Too low, and you're no longer receiving the benefits that help to increase your heart's function. So, one thing you need to be aware of is, like I said, the digoxin toxicity. Perhaps you forgot that you took a dose today and you take another one, and now your what is known as the serum level increases beyond the point where it's beneficial, and now you're at the point where it's harming you. And this can be identified by having things like you don't feel like the desire to eat anymore, you're nauseous, you're vomiting. A big one is changes in vision. So if you start developing changes in the way you see things, or just visual disturbances, then that is an immediate need to go to the hospital, go to the ER, and have that looked at. Now, the second drug you've been prescribed is called lasix. Now, lasix is what's known as diuretic, and it's not a potassium-sparing diuretic. So, basically what it's going to do is you're going to pee more. And the idea is that because of the way your heart is functioning, you tend to have a bit of a backup, if you will. And that extra blood and fluid tends to leak into the lungs and your lower extremities, and you might develop a problem trying to sleep at night, where you go lay down, and basically what's going to happen is that fluid in your lungs or in your legs basically comes back in and starts to fill up your lungs, making it harder to breathe. And so the idea is, with this diuretic, the lasix, then you start urinating that fluid out. And one of the things about lasix that you need to be aware of is the fact that lasix is not a potassium-sparing diuretic. So while you don't need to watch out for your potassium intake, you do need to watch, your basically everything else, your calcium intake, your potassium intake, as always, but your sodium intake, all of that, because, you're gonna start urinating it out, and that means that you need to take in an appropriate amount to substitute what you're losing. Also, because you have CHF, you're going to want to limit your intake of fluids, because if you take in too much fluid, it's basically going to sit in your body and back up, make it harder to breathe, and probably raise your blood pressure as well, which is generally something we try to avoid. So you're likely going to have to look at a limited fluid intake, and keep in mind that you have to plan out the fact that you're going to be urinating out a lot of those important electrolytes. So that if you happen to be changed to a different type of diuretic, make sure you check with your healthcare provider and see whether or not it's a potassium-sparing diuretic, because a potassium-sparing diuretic and a non-potassium sparing diuretic have some different issues. You also should have, while you're here at the hospital, should have had your glomerular filtration rate checked, which is how well your kidneys filter your blood. Now, if your kidneys are not filtering your blood effectively, then, especially with things like digoxin, you really need to have a conversation with your healthcare provider about adjusting that level, your intake of digoxin, because poor kidney filtration will cause you to develop digoxin toxicity. Other than that, this is not a death sentence. It's not a end of life. This should not kill you. It just means you just need to make some adjustments, and preferably reduce your blood pressure to normal levels. Have a more normalized is kind of a weird word. Have a diet that's balanced, and just take care of yourself. And this is as worse as it's going to get. There is the likelihood that you will develop further heart failure as time goes on. And like I said, we're trying to, by utilizing these medications and diet changes and fluid restrictions, to prolong how well your heart works, so that you will live a long and healthy life. And that's pretty much it.